agency to take a really fundamental and leading role in figuring out how to develop a care-first approach. Needless to say, I think we've all been bombarded by input from every angle regarding this issue. And it wasn't that long ago that we were up here talking about involuntary treatment. The issues of public safety and public health are paramount, and they're very charged. And there's really not, there are no simple solutions. If there were simple solutions, we would have already had them. But there are a number of questions, and I don't come at this from a public safety issue. I'm a doctor. And there are many other experts who have a lot more information about the public safety implications about what we do. There are also other questions about funding. How does an approach change the whole context for the funding of this of facilities to deliver care? One of the things that this board voted on very recently was a 5-signature letter to the state urging pursuit of the IND exclusion waiver, which is a big deal. It's a big deal because it'll allow us to do what I think we all believe needs to be done, and that is to increase the number of hospital beds in Los Angeles County. Hospital beds will help us restore, care for, reintegrate those who are in our streets and in our jail. And I think that has become painfully clear to all of us, and the board is leading the way in that direction, and we really, really appreciate that. One of the things that's been brought up here that I do believe in deeply is that, and I'm an aspirational guy, sometimes to a fault, is that parts of the planet that really have developed robust community-based treatment and adequate housing and supported housing, collaborative housing, don't rely upon jails. They really don't rely upon the streets, and they actually don't rely entirely upon hospitals and locked hospitals and involuntary treatment because people are cared for. And it's that type of relentless pursuit of care that we in this department are trying, and I think across the agency are committed to trying to move. And there's so many pieces to that solution, and we're going after all of them. And I say that not just about the Department of Health, but other departments as well. The fact that there has been so much activity, there have been so many motions and directives around studying the needs and figuring out how the needs of Los Angeles County drive our deployment of resource says it all. And I'm very glad to see that there are efforts to consolidate the different studies that are being done. I would say in conclusion that it's absolutely time for us to come together in the broadest sense as a collective. I'll tell you that for me, I don't have a great sense of the flexibility of us going forward with the current plan, and that environments do matter, and that access to care matters, and that the quality of care needs to be intact. And I believe that as a team, across departments at a new level, working with the CEO, working with County Council, working with the Board of Supervisors, we have the opportunity to take an investment and have a massive impact on those who are just as involved because of a healthcare and medical condition. And I'm talking not just about mental illness, I'm talking about also substance abuse and comorbid substance abuse, which really, really drive a significant part of the problem and make this, give us the opportunity to figure out how to heal as a county. I'll end my comments and look forward to your questions.